Imagine a patient in the post-operative ward suddenly developing hand spasm, tingling around the mouth, and severe muscle cramp, cardiac arrhythmia. What could be the hidden culprit? Is it sodium? No. Is it potassium? No. Indeed, it is calcium. And this single mineral becomes one of the most repeatedly tested concepts in most of the examination because calcium homeostasis connects to physiology, endocrinology, surgery, orthopedic, nephrology, and emergency medicine together. Welcome to Surgical Insights with Dr. Deepz. Today we are discussing about calcium homeostasis. Why calcium homeostasis matters a lot. Indeed, it is most important mineral in the body, essential for muscle contraction, nerve conduction, cardiac function, and blood coagulation and bone mineralization. And one of the fear most of the surgeon who have is a small fall in calcium can lead to tetany. It is a muscular spasm caused by hypocalcemia post-thyroidectomy operation. Okay, and today we will discuss about actual facts of calcium homeostasis or calcium homeostasis also can be pronounced. And the body continuously maintains serum calcium within the narrow range, and the normal range of serum calcium is 2.1 to 2.6, and this is in millimole per liter, and in milligram per deciliter is 8.5 to 10.5, 8.5 to 10.5 milligram. And besides tetany, arrhythmias one of the causes for hypocalcemia. Okay, and bone acts as the major calcium reservoirs, storing nearly 99% of total body calcium. Okay, total body calcium. Okay, and in today's video session, I will be emphasizing more about what would happen if there is a fall in calcium in the blood, what impact it would be, and what impact there would be if there is a normal calcium, and what impact would be if there is a rise in calcium. These are the three different session we would be focusing. And okay, in order to remember this concept, I would be taking the example of Dhoom 2 film. Okay, Dhoom 2 film with their characters. Okay, so in Dhoom 2, Hrithik Roshan plays Aryan, a master thief that perfectly matches with parathyroid hormone because parathyroid hormone steals calcium from the bone. Calcium from the bone. Okay, and the Aryan is actually PTH and gold. He steals gold in the movie, which is calcium. And I replace phosphate as a stone here, and I replace calcium as a gold here for making you to understand here. Okay, and here what does he do? How does he steal the calcium? Okay, so Aryan is a master thief who's PTH. Okay, PTH. Aryan who's a master thief, he's a PTH. And yeah, let me activate my pen. Okay, it's a PTF. Parathyroid hormone. Parathyroid hormone released from parathyroid gland. Okay, and it acts on osteoblast. Osteoblast is meaning of osteoblast literally tells you new bone, building new bone. Okay, building new bone, and parathyroid hormone acts on osteoblast. Okay, and further activates osteoclast. Further activate osteoclast, and osteoclast literally means it is breakdown of bone. It is a breakdown of bone. Okay, Aryan used osteoclast to steal calcium from bone. To steal calcium from bone. Okay, and then throws the phosphate out. Okay, phosphate out. Now we would learn what would be the impact in intestine, what would be the impact in kidney and bone further. Okay, impact of bone. Okay, osteoclastic activity, and there will be a bone resorption increase. Okay, bone resorption increase here, and there will be a release of calcium into the blood. It increases calcium within the blood. This is the sequence appear inside the bone. And what about the kidney? Kidney calcium is increased. Okay, calcium reabsorption is increased in distal tubule of kidney. Okay, and phosphate actually PTH throws the phosphate. He throws the stone and takes the gold. So you have to remember in such a way. So phosphaturia happens. Phosphaturia, phosphate wasting, and it excretes in the urine. And within the kidney, what he does, he activates suneri. Suneri, whose vitamin D, active form of vitamin D. How he activates, we are going to learn. So parathyroid hormone, actually Hrithik Roshan activates Suneri. Parathyroid hormone activates active form of vitamin D inside the kidney. So Hrithik Roshan goes inside the kidney and under the influence of 1 alpha hydroxylase, under the influence of 1 alpha hydroxylase, he converts inactive form of vitamin D to active form of vitamin D. Okay, inactive form you can say 25 hydroxy cholecalciferol, that is inactive. Let me write it, 25 hydroxy vitamin. Okay, 25 hydroxy cholecalciferol. Okay, okay, 25 hydroxy cholecalciferol. And the difference between active form is, inactive form is 25 hydroxy cholecalciferol and active form is 125 hydroxy cholecalciferol. Okay, and further it has a intestinal absorption. Okay, from kidney, Suneri goes to intestine. Okay, to absorb calcium and phosphate, to absorb calcium and phosphate. Okay, and here there is a restoration of normal calcium in this way by increasing serum calcium level. Okay, and this is the parathyroid effect of parathyroid hormone effect to restore the normal calcium by increasing serum calcium. So remember in a short that Hrithik Roshan steals gold in Dhoom 2. Similarly, parathyroid hormone steals the calcium from bone in order to uh, increase serum calcium in blood and restore the normal calcium. Okay, so this is how you have to remember. And next is, what will be the impact when there is a normal calcium, when there is a normal calcium in blood. Okay, continuing with Suneri. Okay, Suneri with increase vitamin D activation. Okay, active form of vitamin D, and you get increase absorption of calcium and increase absorption of phosphate in the intestine. And kidney, instead of absorption, it would be reabsorption. And similarly, there is a bone. For bone, it supports normal bone mineralization and it increases osteoclastic activity similar to parathyroid hormone. Okay, similar to parathyroid hormone. Normal serum, again, active vitamin D maintains balance and intestine and kidney and bone and activates osteoclast. Okay, or activate osteoclast. Now here they are stealing the gold. Okay, they are stealing the gold. So Abhishek Bachchan couldn't tolerate injustice for stealing the gold. What he does, he comes as a calcitonin. He comes as a calcitonin. Here, this scenario is about excessive calcium. This scenario is about excessive calcium. Excessive calcium. Okay, excessive calcium. And calcitonin is activated from thyroid C cell. Calcitonin is activated from thyroid C cells. Calcitonin is Abhishek Bachchan, who plays as a Jaya Dikshit in Dhoom 2. And what he does, he actually locks the bone. He actually locks the bone to prevent excessive of gold. To prevent excessive of gold, he places all the gold inside the bank locker, gold locker. Okay, gold locker. And similarly, calcitonin, what it does, it locks the calcium inside the bone by bringing osteoblastic activity. By bringing osteoblastic activity. Let me show you. Okay, osteoblastic activity. Huh? In order to bring the osteoblastic activity, calcitonin inhibit osteoclastic activity. Okay, osteoclast activity by parathyroid hormone and osteoblast activity by calcitonin. This is the main difference. And the more you open, the calcium is flooded in case when it is low, but when it is high, it builds osteoblastic activity, and there will be a decreased release of calcium from bone, decreased release of calcium from bone, and increased deposition of calcium inside the bone, and increase deposition of calcium inside the bone. And coming back to intestine, everything else is decrease. Everything else is decrease. There will be decreased absorption of calcium, and there will be a decrease reabsorption of calcium in the kidney, and excretion of excretion of calcium. Okay, excretion of calcium. As a result, Abhishek Bachchan locks the gold inside the bone, and similarly, calcitonin locks the calcium inside the bone, and as a result, decrease serum calcium and decrease phosphate. Decrease serum calcium and decrease phosphate. Here, I have forgotten to mention in low calcium, the potassium level will be decreased here. Potassium level will be decreased. In order to get the summary, PTH with bone resorption, okay, and calcium retention would be the kidney calcium retention with vitamin D activation, okay, and eventually intestinal calcium absorption would increase the calcium in blood, okay. Similarly, when there is a normal calcium, here active D vitamin maintains active form of vitamin D, maintains balance in intestine, kidney, and bone. Okay, and bone. Okay, and high calcium is calcitonin. Okay, calcitonin increase the osteocla- osteoblastic activity by decreasing osteoclast, and eventually bone storage, calcium increases in bone storage, okay, and decrease intestinal calcium absorption with increased calcium excretion, causing decrease in calcium in blood. Okay, this is the entire scenario. You have to correlate with Dhoom 2 characteristic and then match here. It would become very easy, incredibly. Now we will go with the problems and other thing. Question number 1: which of the following hormone decreases the blood calcium by locking calcium into bone? Okay, locking calcium is none other than calcitonin. Okay, this is the only answer. This is the answer, but all other option we will describe here to make you understand it. Okay, parathyroid hormone first. In parathyroid hormone, this release the calcium. This doesn't lock inside the bone. Okay, this doesn't lock calcium into the bone, but it release. Okay, it release calcium. It release calcium. Okay, and 1,2,5 dihydroxycholifacalciferol uh, increases the absorption of calcium and phosphate in the intestine, and it increases the reabsorption of calcium and phosphate in the kidney, and it increases the osteoclastic activity. This is the answer here. And vitamin D inactive form, actually I can say parathyroid hormone activates the inactive form of vitamin D to active form of vitamin D under the enzyme 1 alpha hydroxylase. 1 alpha hydroxylase. Okay, hydroxylase vitamin. Okay, and the growth hormone we will study in upcoming in near future class for surgical stress, increases surgical stress. We will study growth hormone in that particular thing. And next is parathyroid hormone, has which of the following effect on kidney? Here the answer is, let us go one by one. A decreased renal tubular resorption of calcium. Okay, and increases renal phosphate reabsorption, decrease synthesis of 1,2,5 dihydroxycholecalciferol, increase renal phosphate reabsorption, and decrease renal phosphate reabsorption. So there is no role in phosphate. Hrithik Roshan throws the stone, throws the phosphate. Parathyroid hormone, phosphate is decreased actually, decrease phosphate. So here decreases renal phosphate reabsorption. No, it hematuria actually, hematuria. So we have to think about, okay, we have to think about this thing. Renal phosphate is decreased here. Okay, renal phosphate is decreased. Okay, this is the answer here. Okay, and next question: active vitamin D 125 dihydroxycholecalciferol increase all of the following except. Let us analyze one by one. Plasma calcium, yes, answer. And plasma phosphate, yes, answer. Osteoclastic activity also, yeah, okay. Increase phosphate reabsorption, okay, yeah. And eventually renal calcium excretion, no, not to renal calcium excretion, okay. Okay, so this actually answer is calcitonin does, not the dihydroxy 1,2,5 dihydroxycholecalciferol. Okay, so next, calcitonin is secreted by which of the following cells? Okay, shall we learn? Parathyroid chief cell, no, your answer, no, this answer. Thyroid follicular cell, no. And thyroid C cells, yeah, this is one of the most frequently tested question, one liner question in most of the exam. And this is also not the answer. This is also not the answer. Eventually answer is thyroid C cell. Parathyroid has an immediate action on which cell type to increase extracellular calcium? Okay, whether it is, we will go one by one. So osteoblast is not the answer, osteocyte is also not the answer, and chondrocyte is also not the answer, renal tubular cell is also not the answer. Eventually osteoclast. Okay, this is the answer. Next question, which of the following is an action of calcitonin? Okay, let us analyze one by one. First is increase intestinal calcium absorption. No, not the answer. Increase osteoclastic activity. This is also not the answer. Increase renal tubular absorption of calcium. No. Increase osteoblastic activity. This is the only answer. And increase plasma phosphate. No, not the answer. Okay. Okay. Next is active form of vitamin D 125 dihydroxycholecalciferol increases plasma calcium by all of the following mechanism, except, okay, there is a increase in gut absorption of calcium. Yes, increase in gut absorption of calcium, and increase in renal tubular reabsorption of calcium. Yes, increase in renal. Okay, increase in osteoclastic. Yes, increase in osteoclastic. And next thing is decrease renal phosphate reabsorption. No, not possible. It is increase, always increase. It is always increase. Okay, and increasing plasma phosphate. Yeah, the answer is yes. Thanks for the attention, and we finish this session. And upcoming session there will be hypocalcemia, and please don't forget to subscribe my channel for interesting videos, and kindly like, share to your friends, and comment down the doubts. Okay, and upcoming topics would be interesting. Very thanks. Have a nice day. Bye. Yeah.